Perform hand hygiene. Cover all surfaces of hands with hand sanitizer. Rub hands together until hands are completely dry. Explain the procedure to the resident. Ask resident to state name and verify name matches the name on the diet card. Position the resident in an upright, sitting position before feeding, at least 75 to 90 degrees. Protect clothing from soiling by using napkin, clothing protector, or towel. Provide hand hygiene for the resident before feeding. Candidate may use a disposable wipe and dispose of in trash can or wash residents' hands with soap and a wet washcloth, or they may rub hand sanitizer over all surfaces of the resident's hands until dry. Ensure residents' hands are dry before feeding. Place soiled linen in designated laundry hamper or dispose in appropriate container if used. Sit in a chair facing the resident while feeding the resident. Describe the food and fluid being offered to the resident. Offer each fluid frequently. Offer small amounts of food at a reasonable rate. Allow resident time to chew and swallow. Wipe residents' hands and mouth after the feeding demonstration. Leave resident sitting upright in bed with the head of the bed set up to at least 75 to 90 degrees. Record intake as a percentage of total solid food eaten on the previously signed recording form. Candidates' calculation must be within 25 percentage points of the RN test observers. Record estimated intake as the sum total fluid consumed in milliliters on the previously signed recording form. Candidates' calculation must be within 30 milliliters is of the RN test observers. Place call light or signaling device within easy reach of the resident. Maintain respectful, courteous interpersonal interactions at all times. Perform hand hygiene. Cover all surfaces of hands with hand sanitizer. Rub hands together until hands are completely dry.